All right, welcome to our webinar series today. We have a good group on the line, and so we want to give you a few pieces of information for the webinar. We do have you muted, and so you can chat in any questions or comments as we're going. And so there is a chat box on the GoToWebinar little dashboard. So some of you have found it, but those of you who haven't yet, we've just chatted out where you can chat, so you can just say a quick hi greeting to kind of test it out and let us know that you're on the line. And if you put in questions there as you think of them, then we'll go back through the questions. We may just chat right back to you if there's an easy answer. Or during the question and answer section, we'll go through them, and so I will get Anne-Marie to answer them as well at the end, and then then we'll have some question and answer sections at the end. So we're going to get started here, and I'm going to introduce you first to Dr. Anne-Marie Nicol. We are really excited to have her join us here, and she is going to talk to us about how to motivate people to action. This was part of a presentation we had at our CARST conference last year, and she's updated it. It was a great presentation then, and so we're excited to have her join us. So Anne-Marie, I'm just going to test your volume. Can you hear me?
Hello, testing. Can you hear me?
Good, I can hear you, so I hope everyone else can. If anybody can't, then they can chat and let us know. And I'm just going to hand the tools over to you to start. So I will just give me a minute here. Sorry.
I'm going to try.
There you go.
You haven't handed it to me yet. Okay, let me see. So switch to desktop.
Yeah, you should be ready to go.
Can people see now the presentation? Is it working?
Yeah, they can see the presentation. That's through GoToMeeting. That's on my screen. And so you'll need to use, Anne-Marie, I think you just switched off of GoToMeeting to your own desktop. You want to stay with the link that you were on.
Pam, can you hear me?
Yes, you're back. Good.
Okay, I just have lost the screen. That's all. Okay, I think we see it now.
Okay. Good.
Okay, and can I move the screen? That's my only question. Oh, I did. Okay, great.
Good.
Okay, and everyone, the audio is fine for everybody. Am I loud enough?
Yep, I'm getting comments that they can hear you, so that's good.
Okay, excellent. Do you want me to introduce myself? I'm more than happy to do that.
Yes, that's perfect.
Okay, so good afternoon or good morning, depending on where you're calling in from in Canada. And my name is Anne-Marie Nicol. I am an associate professor at Simon Fraser University here in Vancouver, so it's kind of early here in the morning for me. I also am the co-principal investigator of CARST Canada. And I just want to say to begin with that I am not a radiation scientist, nor am I a trained radon professional, but my area of expertise is health promotion and behavior change, and what it is that motivates people to take the steps that they need to protect their health. And that's part of why I find radon such a fascinating area to work in, because like many of the other challenges facing public health, it's something that we really need people to actively do something in order to make a change. And the other part that amazes me about radon is that in terms of lung cancer implications, it's much easier to test and remediate for radon than it is, for example, quitting smoking. So for me, there's a whole host of really fascinating things within the whole radon story that we can talk to about health promotion and health behavior change. So what I wanted to start with was just talking a bit about the epidemiology of radon gas and its implications for lung cancer. And there are a lot of really great Canadian resources that are publicly available to people if you want to be talking to the community about why radon is an important issue for cancer. And I often, when I speak to people, I hear things like, well, I've never heard of this, or, you know, how do we know that the research is true? And a lot of that can be answered, I think, with some helpful infographics and a discussion of how major global entities like the WHO and the International Agency for Research on Cancer clearly demonstrate that radon is a lung carcinogen. And this, what I'm showing you right now, is a publication that was put out in Ontario by Public Health Ontario, which is really fantastic. And this infographic in particular shows the estimated annual number of cancer cases from environmental exposures in Ontario by group. So that the first one there is solar UV, and the next one is radon. But the distinction here between these two is that solar UV causes cancer, but these are the kinds of cancers that many people survive. These are different kinds of skin cancers. Radon, the next one, is much more significant because most of the people that have cancer that are diagnosed actually die. So the burden of mortality, so while this graph makes it look like solar UV is the most significant, it's actually radon in terms of number of dead bodies that we're seeing of excess cancer cases per year in Ontario. Now, in a perfect world, we would have this for every province, but I can tell you, and probably people from Ontario, if they're on the line, can tell you that this was a challenging and expensive report to pull together, but it was done really well, and I think that this can be helpful for people as a way of sort of discussing the significance of radon compared to many of the other things that we grapple with. And if you look down there a little bit farther, fine particulate matter, that's air pollution, followed by secondhand smoke. And we can see that the burden of cancer is much lower for those things, even though they get a lot more press than radon gas. And then just a comment, the two top things that cause the most cancer are radiation-based. Those both solar UV and radon fall into the area of radiation exposure. And then we have air pollution from PM and diesel. And then even secondhand smoke is much farther down. So when a lot of the carcinogens that we talk about in the news that you hear about, yes, they do contribute to the burden of cancer for Canadians, but far, far less than radon gas. So on the next slide, hopefully it just takes a bit of time for my slide mover to go. Pam? Can you help me move this slide? Oh, there it is. Sorry, I think it has fade on it. So the next slide, this shows you the beginning of that's what the front page of the publication looks like. And then they've also done a nice job of making these a little more infographic-y. So if you're making presentations to go out into the community, it's pretty easy for us to use these examples in the work that we're going to do. And again, you see that it's very clear that this causes 1,300 or so cases of lung cancer annually from radon gas. The other interesting statistics that are publicly available to people, if you'd like to be speaking out in to groups, this is Statistics Canada. Every 2 years, asks Canadians questions about radon gas. And they've been doing this actually since 2007, but some of the very early surveys they didn't really have enough responses. So as of 2009, they've been tracking the number of people who can correctly describe radon gas over time. And these are easily accessible statistics. They are some of the best statistics collected anywhere in research in Canada, done by the federal government with representative samples of the population. So this is essentially the census. It's the different version of the census. So these are the kind of statistics that you can trust. And you can see across the country that we are starting to see an increase in the number of people who can correctly describe radon gas. So that's kind of good news. We're seeing an uptick. There's actually a number of different questions, and if you're interested in learning these statistics for your province in particular, I'd be more than happy afterwards to help walk people through where the tables are. And you can actually drill down to the metropolitan areas in your province if you want to know, for example, Toronto versus some other Ottawa, in terms of, because they've asked these questions in greater municipal areas as well. So there's one more layer city-wise that you can learn the statistics at. And the questions did change a little bit in 2013, just to put a caveat there. So these statistics, again, are freely available and I think are quite compelling to show that we are really starting to have a greater impact on people's awareness of radon gas. It's the next slide that is a bit more discouraging. They also ask on that survey if you've tested for radon gas. And if you walk through the statistics, you'll realize that the people who answer the question, have you tested, is a subset of the people who actually knew about radon gas. So we're saying that only half of Canadians have heard of radon gas, and then of them, it's only about 5% that have tested. A little bit more in Nova Scotia, maybe about 10%, but that's still 10% of that half. So that's really a very, very small proportion of Canadians have actually tested. And as far as I'm concerned, this is where the biggest problem is that while we might know that radon is bad, what we're not seeing is the kind of follow-up action, the health behavior that is going to lead to any kind of change. And so this, if you would do a corollary for smoking, it's like you might know that smoking is bad for you, but you haven't taken those steps yet to actually make a change to reduce your risk. So what more needs to be done? We really need to, I believe, not to just be focusing on telling people about radon, but really to be making the testing of radon a more significant issue. And then, of course, so there's awareness here. So still over half of Canadians really aren't aware of what radon gas is. So we need more awareness, but then we need to get people testing. And then here's the big question over here is, of those people who've tested, who is actually remediated? And Health Canada did do their follow-up survey from their Cross Canada survey to see who had mitigated. And I believe, if I'm not speaking out of turn, it was over 50% had tried something, but not all of that was subslab depressurization. A lot of it was other things. And you can imagine that that kind of study would have a much different response rate than a community level testing event. If the federal government provided you with something, provided you with a lot of support and information, you would probably be more likely to do something about a problem if they told you it was high. That, again, coming from a national, serious federal entity, the impetus to make a change psychologically probably would be greater than if you just bought a test at a hardware store and the answer came back 300 becquerels per meters cubed. So we haven't really seen the sort of in the wild or actual, like what happens if these sort of statistics on radon mitigation rates in Canada are actually pretty scarce. So if anybody has data on whether or not people that they've worked with have actually mitigated their homes, I'd be very happy to hear about that. So behavior change is hard, and reducing behavior change, reducing exposure is in most cases the way that the current system is set up. The idea that everyone is told to test their home is really about behavior change. And it's not just for the public, though. I believe that governments and medical professionals, occupational health and safety need to change too. And the things that they can do include asking people about whether or not they've tested their homes for radon and developing better policies. Now, behavior change is different than structural or engineering changes. And there are programs afoot in Canada, for example, even the building code, if we think about it, that's the kind of structural change that could be implemented that then people don't have to worry. The idea that we're building radon out, if you can design a home that has a radon system in it that effectively deals with the problem, then you essentially, as a homeowner, wouldn't even need to know about radon unless you needed to check to see if the system is working. And well, theoretically, that's where we're going in Canada. Anyone who's familiar with the building codes realizes that people still need to test their homes to see if their system needs to be completed. And so while we've sort of halfway got to structural answers, we really still are relying on this issue of personal behavior change to make a difference. And theoretically, if you think about this in a much bigger way, it's kind of like the debate on tobacco. You know, should cigarettes really even be allowed to be sold in Canada, because we know how dangerous they are and the impact that they have on our public system. So, you know, whether or not systems should be designed completely to remove radon from people's homes and they don't even have to think about it, is another potential structural change that I think could be implemented that would reduce having to offload the burden essentially onto the public and the homeowner. And these are big theoretical ideas, and I'm more than happy to talk about a lot of this afterwards. So if we go to psychology, people have studied behavior change, not so much in the area of radon, although these authors actually did take their hand at radon. These are American psychologists who got involved in issues around nuclear siting and acid rain behavior change, those sorts of things in the 70s and 80s in the United States. And they came up with a list of different aspects about hazards. They psychologically assessed them to see what are some of the things that actually help make people make changes in their life. And what are the things that get people upset enough or motivated enough to make a change? And so they organized feelings and concepts into things that make people feel better or less concerned about a hazard, and the things that make people more upset or more concerned. And so if you're told that something's okay by a trusted source, if an exposure is voluntary, so for example, the risks that you would have from going skiing, if you're in control of your risk situations, for example, driving, we often hear about this with people who drive drunk. They feel like they're more in control when they're driving, so they don't think that driving drunk is a problem. If you're familiar with a hazard, so lead is another one of these, people don't get all that upset about lead in their homes because lead paint is something that we all seem to know about. Even though we should be concerned about it, it's kind of a familiar thing and people assume that it's been dealt with. When hazards have small impacts on people, statistically small, like 1.2%, people don't seem to be too concerned. When adults are at risk versus children, it's not such a big deal. If it's a natural hazard, people tend not to get upset until they're massive things like huge earthquakes or volcanoes. And when things don't cause dreaded diseases, so when they cause things like arthritis, that's not dreaded. Pancreatic cancer is a dreaded cancer because we know that people die pretty quick. Even breast cancer, most cancers are considered dreaded diseases. And then if a risk is equally opportunity across a whole population, people tend to not get upset. So over here, these are the other things, the other attributes of hazards that tend to get people really upset. So if it's industry telling you they spilled something, if you got exposed and you didn't know or you can't control it, if it has a big fancy name, tetrahethylmethylchloride, you don't know what that is, if it's going to kill a lot of people or a high death toll, if kids are at risk, if humans have made the problem, we get more upset. If it causes cancer, and if only some people get it and others don't. These are the things that tend to get people up in arms about stuff. And I'm sure most of you are sitting here thinking about radon and realizing that a lot of that stuff actually kind of does fall on this worst side. We should be seeing what's called outrage as a result of a lot of this. So I'm going to walk through some scenarios using this. This is essentially what's called a theoretical model, but we don't need to worry too much about that wording. But if any of you are psychology buffs, this is a theoretical model. So if we walk through these, looking at perception of radiation from medical scans, so if we want to understand what people's ideology is around radiation in general, so we're taking a step back from radon, and let's just think about the other radiation that people come in contact with in their life. People who are radiation from x-rays and scans, you're told to get one by your doctor. So you're not that worried about it. You assume that your doctor knows what they're doing. You don't have to get a CT scan. It's, in fact, people fight to get CT scans. So it's voluntary and controllable. It's a bit exotic, so some people have some anxiety about those tests, but most people really don't understand them. They don't understand that, for example, an MRI actually doesn't give you any radiation. The risks are there, but people tend to talk about them in small statistics. If you've had a CT scan, your doctor may have said to you, there's a small increased risk of excess radiation. Mostly adults get CT scans. Some kids do, but it's mostly an adult thing. It is human-made, so that's why that's orange here. But it's not dreaded. It's a medical test, and if you, in fact, being distributed fairly, like I said, most people would be happy to get their CT scan sooner rather than later. So in terms of equity, if you can't get one, you're upset because, say, it's too long, the wait list is too long. So we know that people really aren't concerned about medical tests and medical scans, even though it makes up a significant burden of radiation in people's everyday life. On the next slide, we're going to think about radiation from a different perspective. So the radiation that came from Fukushima, so even in Canada, this is not in Japan. Let's think about Canada. We had incredibly low amounts of the radiation from Fukushima that arrived on the west coast of Vancouver. But I can tell you, as somebody who worked in public health, we had a lot of calls. There was a lot of outrage and anxiety in the population about all sorts of things. And you can see why, is because it loaded on this side of this scale. The Japanese government was saying things that contradicted what everybody else was saying. So all of a sudden they're untrustworthy. We didn't expect to be exposed to what happened. It was involuntarily and uncontrollable. Having a nuclear power, having a tsunami and then a meltdown is kind of a rare thing to have. So it's kind of exotic. It was indeed catastrophic. People were dying, children were dying. This was definitely a human-made hazard and human error that contributed to the meltdown. It does cause radiation sickness and cancer again, so we're overloaded here. But again, the exposure was so much less than you would get for just one CT scan for anybody here in North America. So from a public health perspective, these are not even apples and oranges, like these are apples and crackers. But from a psychological perspective, people really engaged with their concern on Fukushima and not fairly distributed again. So let's move along now. The implications of the Fukushima, I think some things that we can learn from this is that people can change their mind about radiation based on events that happen. So when they polled people after the Fukushima disaster, they found that there's a lot more heightened anxiety now about nuclear power than there had been previously. And in fact, a lot of the nuclear power development programs were put on pause for a few years after Fukushima because governments realized that they'd already upped the outrage, that Japan had upped the outrage around nuclear power siting, which if anybody is familiar with this area, you'll know that most people don't like nuclear power plants put in their backyard. So are people concerned about the radiation risks from radon? And I've run it through the psychometric paradigm, this theoretical framework here. And this is my understanding. I welcome comments from people afterwards about what they think about these psychometric paradigms. So I think in red is a definite yes, orange is somewhat, and then I think the blue is areas where we could probably consider, because if we want people to start to pay attention, we're probably going to need to move them over here to the worse from the better. This means people think it's less hazardous, and people this side, it means it's more hazardous. And I believe radon is suffering from the idea that most people don't understand that it's hazardous, and we could benefit for a bit more outrage in the population. So who's talking about radon? Are trusted people talking about radon, or untrustworthy people talking? And right now, I think that we're hearing some from the government, and people tend to trust the government, but only to a point. And we don't have doctors talking about radon. And when you look at who people trust, they trust their medical professionals first, but they also trust university scientists. So if anyone's familiar with Aaron Godarzy in Calgary, you'll know the significant amount of success he is having getting people to test, because he's got his lab coat on, he's talking to the press, and he's telling people that this is a serious issue. And he's done a fantastic job at upping the number of people in Calgary that have been, in fact, Calgary will soon be one of the most heavily tested parts of Canada because of the work that Aaron is doing. Is it voluntary or involuntary, your exposure? So, you know, are you exposed to, do people select to be exposed to radon gas? I don't think so. I think that it's involuntary, and that's something that we can probably talk about a bit more in the next few slides. I'll explain why I think that is. Is it controllable, radon gas? It is controllable, but I don't know that most people know that. Familiar, most people think about the things that happen inside their home as safe. People believe that pollution is something that happens outside the house, not inside the house. And this isn't just for radon. Most indoor air contaminant research suffers from this problem because people don't believe how high the levels of things like formaldehyde and benzene, or even how significant something like mold can be for people's health inside their home. Our home is our castle, and we really think that it's safe. People talk about radon gas a lot of times in statistical ways. We talk about increased risk. I think we should be talking about it more in the sort of burden level, like that Ontario publication. We focus a lot on adults and homes. We could be talking about children. This would ramp it up this way. Is it a natural hazard? It is naturally occurring, but I think every time we say naturally occurring, we might be doing ourselves a bit of a disservice, and I'll talk a bit more about that in the next slides. And is it dreaded? I don't think it's dreaded because I don't think people know what radon gas is, not yet. And is it distributed fairly? I don't think that it actually is distributed fairly. So I'm going to go into these blue parts in my next few slides. One of the first ones I think we can do is rethinking the voluntary, involuntary exposure. I think one of the things that we could be using when we craft messages is using this construct. You're being exposed to radon gas and you don't know. This sort of silent killer type messaging. And the asbestos industry has used this very well. They've called asbestos a hidden killer. So you're living in your home, you've got radon gas in it, you don't know. This kind of messaging actually might be an effective approach to talking about radon. The things in your home that you don't know about are problematic. And the US EPA had a green socks program at one point, which did a really interesting job of talking about children and involuntary exposure together. So if people haven't seen the green socks program, it's really worth going to look at because it has a really interesting application of a lot of the things I'm talking about. So are children at risk? And I believe that orienting radon promotion to what I call early life or early years exposure was probably going to be a fruitful way of getting more people engaged with radon. We know that parents and grandparents get much more engaged when things cause problems to kids. And we can even think about this from the government's banning of bisphenol A. We knew that that was a problematic compound that was put in plastics, and one of the first things they did was they took it out of baby bottles. So we're trying to protect the people who are most vulnerable in our population. And there is a debate as to whether radon is or is not more dangerous to children. In general, though, you want to reduce risks earlier in life because then you have a less time of your life to live with that burden of the hazard. So regardless of whether or not radon is more dangerous, it still makes sense to reduce issues for children. And personally, I'm doing work on radon in schools and childcare facilities because I believe that these are places where not only can we get people engaged about radon, but we can also get them talking about radon in their homes as well. So we can go to daycares, and it's actually working. I'm in the middle of a project here in Vancouver where we're testing, the health board is testing schools. I've sent a letter home, and I'm getting parents calling me and saying, I want to test too. So teaming up with school programs or daycare programs to get residential testing going seems to be fruitful. And I think we can do more. In the United States, they had a pilot project with nurses who went and did well baby visits, And they also do things like child-proofing a home. They tell you about your electrical socket. They tell you about carbon monoxide. These public health nurses could be talking about radon gas levels as well. We also know that dads are getting more and more engaged with early life care. And this could be something that a dad could do. You could say, hey, mom's got a new baby. Dad, are you concerned about your indoor air quality? Why don't you get a radon test kit and get your radon testing going? So I think that there's because people really are suddenly aware that they've got a new human being in a new environment, and maybe we should make this a safer environment. And Saskatchewan is doing some great work on their Little Lungs projects as well. So just a shout out to anyone from Saskatchewan. So is radon distributed fairly? And the reason that I'd put a star down there is because if we think about radon from the perspective of somebody who lives within a rental accommodation, it becomes a very different thing. Renters aren't in control of their environment. They're, often where rental, it's hard to get. The last thing you're going to do is say, I'm not going to rent that basement suite in Vancouver because you've got radiation in it. Like that's rental housing in Vancouver anyway is so rare that people take whatever they can get. You might have children, especially in low-income rentals or single-family rentals. There often are children in rental accommodation. Again, this human-made hazard, I'll come back to that. But it's not distributed fairly. And it really does seem unfair that tenants don't have the right to test. So on the next slide, I've pulled the information that Health Canada has on their website, and I've been taking this around to groups and asking them how they feel about these two statements. I'm renting a house and I'm concerned about radon. Is my landlord required to test? No, there's no legal requirement. I tested my house, the reading was high. Is my landlord required to fix the problem? No. So personally, I have some lawyers working on this because it seems really to me incredibly unfair that there are no rights for what may be some of the most vulnerable people in Canada, particularly in places like Saskatchewan and Manitoba, where there would be ground level suites, underground suites. This seems like low income housing is often this kind of housing. So if we think about this from an equity perspective, which I can tell you is very big in Health Canada at the moment, concepts of equity, we could switch this issue to be something that more people are going to get their head around. So is radon dreaded or exotic? I don't think so. I think if you say the word radon, people kind of might think about radar. Like if you've never heard about it, and I just did a radio interview yesterday and the radio host was like, what is this radon thing? I have no idea what it is. So if you don't know what it is, you can't be afraid of it. It doesn't sound particularly exotic. It doesn't sound like bisphenol A. Like what is that compound, bisphenol A? And it's interesting. So Peter Sandman is an amazing risk communication guru, and he did this work again. Look at that. That was in the 80s. He said it was interesting that the deep fears and anxiety associated with radiation don't seem to extend to naturally occurring radiation. And this was evident in a survey they did in New Jersey, a region that has a lot of radon levels in it. People were kind of apathetic about the risk. Now, if you think about the nuclear, even 3 Mile Island, or concerns about Fukushima, people were really, really upset about Fukushima. It's radiation, and in fact, the kind of radiation from radon is some of the worst radiation to have in your lungs. And if we contrast this then to fears of other kinds of radiation, nuclear energy conceived in secrecy, born in war, and then first revealed to the world in horror. So no matter how much people try to separate nuclear power from nuclear weapons, they really aren't able to do that. So there's a lot of societal anxiety around nuclear power. The irony being that the number of deaths from nuclear power plants outside of the Fukushima incident, so if you look in North America, less than 1 person dies every year in North America from nuclear power plants. And if there are fatalities, there are things like people falling off ladders. People don't die from nuclear power generation in North America at all. So this is from the nuclear part. But people are very, very concerned about nuclear power in general. So while it is safe in terms of occupational health, it certainly doesn't manifest that itself in people's psyche. And I think, you know, what's even worse, and I'm not at all here saying that EMFs are without risk, but so many people are concerned about electromagnetic fields and Wi-Fi. And from a radiation point of view, this is non-ionizing radiation. This is not the kind of radiation that actually breaks bonds. It's not at all like alpha particle radiation, which is very, very dangerous. EMF is much, much lower down. It causes other, potentially causes other kinds of health effects, but we're not talking about lung cancer, which is the biggest killer of all cancers that Canadians exhibit. So we can really get people upset about EMF, but we can't seem to get people up in arms about radon. So when we're talking about, and again, this is a shout out to Public Health Ontario, we probably could do a bit more to talk about radioactivity and sort of introducing this concept back. What is radon? It's a radioactive gas. I think that we need to be pushing this idea of associating radon back within the family of exposures through which it occurs, because people obviously are sensitive to the concept of radiation. So just talking about radon, it's a gas, I think is less effective personally than pushing the aspect that it is a radioactive gas. This is an infographic that again is available from Public Health Ontario, and it has some fantastic, easy to read visuals for people. And is radon naturally occurring? And I've had a number of conversations with many of our CARST board members, including Scott. So if you're on the line, Scott, 2 thumbs up to you, because I think that we need to stop really talking about radon as a naturally occurring gas. Sure, it exists naturally in the world, but it's a result of the built environment. We are building a radon problem into newer homes. And Dr. Godarzi's research also showed that it's the newer, bigger homes, the more energy efficient homes that have higher levels of radon. So rather than getting better over time, we actually may be making we may be building a worse problem with our newer, tighter homes than we have in the past. And it's not the radon that's changed, it's the housing that's changed. So this is really more of a human-made problem, or you could say man-made, but we'll just say human-made problem, than it is a naturally occurring problem. So when we say words like natural and background, in many ways it trivializes risk. The exposure is still a problem. Arsenic is naturally occurring, but it also causes lung and skin cancers at very high rates. But that's a whole other carcinogen issue. But we can talk about radon in the context of the built environment, and I think it shifts the conversation a little bit. So what else do we need to do to help facilitate behavior change? And what I've been talking about up to this point are psychological ways of reframing our messages to perhaps touch on things that are going to get people more engaged with the conversation. But the other things that we can do is we can start legislation and regulations that actually make a difference. So we know that if you make laws, people have to comply to them and they make change. So some of the most significant public health laws in the past 30 to 40 years have included seatbelt laws, children's car seats, and smoking in the workplace. These things have actually been revolutionary in terms of reducing mortality from car accidents and reducing the number of people that smoke. Really kicked in after smoking was banned in workplaces. We're also seeing now things like fines and tickets for distracted driving, which they believe has increased 4-fold the number of people in accidents, in car accidents. So it's in the government's best interest to really get these procedures out where they're ticketing people and fining people, because those sticks, there's sticks and carrots in the behavior change world, those sticks are starting to work to reduce the number of people who are actually driving while distracted. So, you know, maybe so laws and policies around radon, we've just seen that Alberta has moved towards licensing of radon requirements in Alberta daycares. The Yukon is following suit too. They're requiring testing in schools. They began the schools and daycare testing in the Yukon, and some other provinces require all schools to be tested as well. So these legislative pieces are important because they often lead to very direct and real change. So there's lots more radon related laws and regulations that we could think of. And then in terms of carrots, we could be rethinking how to positively lead people towards radon change. So Health Canada, Winnie Chung in Vancouver had a really neat idea at one point, and I know we talked about it with Pam and others, which was having some positive, a window cling sticker you could put on your house that said, hey, this is really great. We tested this house for radon, and it's very low. And so in terms of radiation, the indoor air quality is safer. And those sorts of ideas, we haven't seen a lot of that in Canada. We haven't seen this sort of positive, yay, we tested for radon. And I think that this is a great incentive that we could be thinking about that would be fairly cost effective too, at help bringing together people who have done the right thing, essentially. So in conclusion, how we frame and discuss radon influences how people perceive it. So our messaging is actually really important. And when you're talking to people, most of you are probably trying to persuade people or support people in their interest in both testing and mitigation. So the words that you say and the messages that you use are important. We know that there's variables that increase or decrease perception. These have been well established, not just in radiation, but for many other hazards, known hazards as well. So this is the psychometric paradigm. That's the theoretical model I walked you through. Most people have a preconceived idea of radiation. This came way before they heard about radon. It has to do with their understanding of nuclear power and nuclear war. And we could be using that understanding a bit more to explain what's going on. And I can tell you in the medical world, there is concern about the number of people who have significant or high levels of CT scans. Doctors are getting more and more concerned about the amount of radiation that people are receiving from medical diagnostic tests. And that, like radon, it is another significant contributor to overall exposure to radiation. But again, most people aren't that worried about it. So if we talk about radon in the context of not being equitable, it's not natural, it's because of the built environment, and it's not boring, it's radioactive, it causes cancer, it's bad for babies, it's bad for children to be exposed. I'm joking that your home builder is trying to kill you, but if we think about the idea that your home is a place that should be safe and that it's, you know, you're being exposed and you don't know, that sort of involuntary concept that's there. And then beware, it's a hidden risk, the silent killer, the invisible risk. These are some of the words I think that we could start to use a bit more in our communication to help promote action. So I'm going to turn it over to people. I think there have been some comments as we've gone along, but we have 15 more minutes now, and I'm really interested to hear what people have to say or think about, or if you've tried any of these messages. I mean, we know that scaring people outright is not the best way to go. So if you terrorize people, they shut down and don't do anything. Psychology is very clearly shown that when people are really outraged, they don't do much. But if you get them a little bit upset or a little bit galvanized to write that letter to their government, or if you start to say, hey, this doesn't seem fair, it's those kind of messages that really get people more talking about, you get the dialogue going in a community and you can get things done. So somewhere between scaring the pants off of people and minimizing radon risk, there's going to be a sweet spot for us to help engage more in kind of the things like policy and regulation that are also going to make lasting real change. So I'm going to stop talking now and hand it back over to Pam.
All right, sounds good. Thanks very much, Dr. Nicol. It's been it's great information, and so I would like to go through a couple of the questions that we've had as we've been going through. Just quickly, one of them, Jean talked about a presentation on radon and cannabis. I think that's an interesting idea too. I have pursued it slightly, and I think we may have one that touches on it. I'm just trying to get the abstract, but yeah, interesting idea. Also, just your comment about the location of the Stats Canada information, and I think that would be great. What we have typically done is kind of put this recording of this webinar out online and then some references that are relevant to that, and so we'll maybe put together a list of some of that relevant information for people to be able to access and find the stats for their province and their area. So we'll get that out to you, and then if you want to help with looking into it, we can help you with that as well. A few comments too that I'll just sort of go through verbally. The idea that it would be helpful to have government assistance for mitigation. and just some of the policy. The new building code is helpful, which is across the country, except for Quebec and Ontario, which is areas that we are looking at trying to get some changes to the building code there. One question about, and maybe Anne-Marie, I'm curious on your thoughts on this question. Do you see radon professionals perceived as a trusted source of data?
I actually have a sense that most people wouldn't know what a radon professional was. And in some ways, that's actually a good thing because it opens up, you can come out of the gate as a trusted professional. So yesterday, when I did this radio interview, the first thing I said was, Health Canada certifies radon professionals because this is such an important issue and they don't want just anybody showing up in your house to tell you something about a odorless, tasteless, invisible gas. So I think when radon professionals are out in the world, they really need to talk about the fact that they've been certified by the federal government. And I think that helps people feel a lot better. It's like the Better Business Bureau in a way. When you see that BBB sign, you tend to feel a bit more confident in what it is that the people have to say. So I think if radon professionals really push the idea that they're certified by the federal government, not just certified by the federal government, then that's something that's going to go a long way to making people feel more confident in your credentials and what you're doing.
Yeah, I think so too. I think, one quick comment on that, I do think that C-NRPP, we need to be more proactive getting information out to governments and homeowners across the country to make sure they understand that our certification exists. And then I also want to remind our professionals that telling them and giving them the information will help with that. I do also think it depends on the individual and the circumstance. Sometimes using Health Canada as the reference, like Dr. Nicol said, is helpful because they're seen as trustworthy. Sometimes they're not seen, depending on the group or the individual. Sometimes the government isn't the trustworthy person. And so sort of setting yourself up to understand how you are perceived or what area you are perceived as trustworthy would be helpful. So if you're giving information on an area that you're not an expert in, now you're going to compromise your trustability. So make sure that when you give information, you're talking about either an area of your expertise or your experience, and then have a second source for things that are outside your experience. And so either reaching out to some of these pamphlets that Health Canada has produced, or some of the material like Ontario Public Health material where they have done research. So you can say, look, these are the experts in this area and that sort of thing. Those are tools that can help with getting experts.
That's why I wanted to show those Public Health Ontario resources, because they are very visually compelling. They're simple for people to understand. And even if you have that bit of conversation about, radiation is the thing that is causing the most amount of cancer in Ontario.
Yep. Yeah, and I was going to note on that, those are newer resources. Public Health Ontario's previous resources were actually quoting 850 deaths a year. So they've updated that and increased that. So just a note on that. One comment about pets.
I like the idea of pets, actually. I think that more and more people are concerned about their animals, and there are questions about whether or not animals are dying more from lung cancer than not. I don't have an answer. If I had all the money in the world, one of the studies that I would do would be looking actually at cats, because cats tend to live inside more than dogs do, and doing autopsies on cats that die to see if they have any changes in their lungs as a result of living in high radon regions. So I think that talking about pets might be fruitful. I haven't seen anybody do it yet, or if someone has, maybe they could talk a bit more about it. But you could talk about all the entities that live in your home, your family and your pets, because they have lungs like everybody else.
Yeah, we have had a couple situations where people have brought out their pets. There was an article a news series that was done here in Winnipeg that I participated in, and it was with a homeowner who that was their motivation for testing and fixing. So she didn't have children at home, but she particularly loved her dog, and that was her motivation. So the Lung Association had her on, and she brought her dog along to the interview, and I think it was a really effective way to talk about it, and it may be a little bit innovative. Another situation is we do have an individual in Ontario who has lost both his wife and his dog to lung cancer, and so that's another message that Ontario Lung Association has been promoting his story, and so I think that one's an interesting new one to use.
If anyone knows a veterinarian who'd like to do this, looking at animals and lung cancer rates, it would be fantastic.
Yeah, okay. Oh, and Scott's talking about an individual who both their cats died of lung cancer. So, yeah, definitely getting out those messages.
Scott, is Scott on the line? Does Scott want to talk about naturally occurring versus built environment at all?
I can try and unmute you, Scott, if you want to talk. For anyone else who is not able to use the chat and wants to have some questions, there's a couple options. You can either unmute yourself and then talk audibly, or you can send me an email and we will follow up with an answer. So email info@carst.ca, and we'll be checking those emails in the next day and make sure we get back to you with answers. So Scott's on the phone. He has a PIN number, but I don't know if we'll see if he's able to jump in. And just while we're waiting for that, I do want to make sure that we let you know about some things coming up. So we do have, this is our monthly webinar series, and so we will...
Hello?
Oh, there he is. Okay, Scott, do you want to answer Anne-Marie's question?
Yeah, it's a miracle. I made it through.
Yeah.
Yeah, so it's interesting. The World Health Organization, like they will even state that, you know, sure, radon's naturally occurring, but it's really how we engineer our buildings and how we use those buildings and manage them that really causes the high radon levels to occur. I mean, you can think of, you could find an area, maybe it's in Cornich, Saskatchewan, or some place where there's a strong source in the ground for radiation. There's a permeable soil that can travel really easily. But if you were to test, let's say, all of those buildings on the main street of that town, you'd think that, okay, maybe these should all be high. But what you'll find is some are low, low, high, high, low, low, high. You'll see this crazy random pattern. And it really ultimately comes down to the structure itself and how they're working in that building. So how many openings are there to the subsurface materials, and how many air changes per hour there are in that building. Is it really old leaky and a lot of air is changing a lot? Is there a strong HVAC system in there that flushes the air out and tends to pressurize the building and push the radon out? Or is it a type of building where they have like little baseboard electric heaters? There's a strong negative pressure inside that house, and compared to a positive pressure in soil underneath it, and it tends to sip and draw the radon in. You've heard of this thing maybe called stack effect, where heat rises. Well, in certain buildings, there's an enhanced stack effect for a number of reasons, and that is really the main driving force that pulls it in. So it really ultimately comes down to the structure itself that says, yeah, we're going to have high radon or not, because in any area in Canada, you can have buildings side by side that one could be high and one could be low. So it really is it's like a building science issue even. Mm-hmm. And so that's, I think, an important thought to keep in mind. And of course, still, every single building, you never know, could still have the potential to have high levels. So test, test, test. There's my mantra there.
Thank you, Scott.
Okay, no problem.
Yeah, and I think creating a villain for the radon issue is tricky, because we don't want to alienate the building industry. We're trying to get them engaged, and if we create our homes as a villain, then that alienates them. We don't want people to fear being in their home or energy efficiency, and so we don't want to go that way. But somehow we need to create a villain of the gas itself coming in, and I think. One example that's done that is Health Canada has a poster of a house with this green stuff that looks like slime coming in, and so that is a method of making it a villain. It does confuse people because radon isn't a green slime, but I think for those who can jump over that, it's a good way to do it.
And that's a really good point too. Like it's not the builders purposely doing it or knowing it or anything. It's a challenging thing. It's a little tiny atom that can come inside a home, and it can be challenging to make sure that levels don't increase to a high level inside a building. But builders are working with government across the country and with new building codes and new methods and technologies, and that industry is really changing because there's a lot more awareness there, just like for any other Canadian, than there was before. So I think people are jumping on board, and like all the builders, the code writers, all that kind of thing, they're aware of this, and it's all moving in a very positive direction.
I agree, and I think one of the things that I've been saying here in BC, because we don't have the building code applied across the province, is I'll go to one region and I'll say, did you know that in the interior they build buildings to be safer for radon exposure than they do here? And that inequity gets people fired up. So in the absence of a villain, the problem there is that people have an innate sense of fairness. And when you say this is not fair, or you have the short end of the stick, that gets people motivated. Like, hey, what do you mean my house isn't as safe as one, right? It's in Kamloops. It's not fair.
Mm-hmm. Yeah, absolutely. And a lot of that unfairness, you could say, still has to do with just awareness and knowledge, as it's not widespread everywhere, and certain areas, certain people, certain organizations are having more knowledge than others, and so but I think that it's all reaching a common level, though, slow but sure.
Yep, it is happening.
One comment about the radon rough-in, which I think is a good point too, is that people don't understand it. And so we do need to get better information for that radon rough-in so that homeowners realize it's not a fix,
yeah.
And then
it's a piece of the puzzle.
Yes, there we go. Yeah, very good.
But that testing piece, and that's part of why, engineering solutions are great, but we don't have them. We are not engineering buildings to be truly radon resistant. It's only halfway. And we still need that education piece to get people to test their new homes. Yeah. And that's not happening.
Yeah. So this is a good start to the conversation, but we would like to continue it. And so you can watch, we are anticipating having some follow-up conversations in coming months, probably starting with one at our CARST conference and then doing another one after the CARST conference online. So we'll keep you up to date on that. But we are coming up to the close of the hour, so I just wanted to quickly do a few announcements. So like I was starting to say earlier, we do have the next webinar coming up in February. The topic is going to be some tips on how to set up and run a trade show booth. And so we don't have the date, but watch your email and we'll send you that date. We also want to remind you about the CARST conference. So that also is coming up in April. We have a field trip planned on the Saturday, and so you'll see some details coming out about that. We're going to have a stream that goes into a residential mitigation and one that goes into a commercial mitigation, and then half day at the National Research Council's facilities where they're going to show us and talk about some of the research they've been doing. And then the Sunday also is a pre-conference day with continuing education courses, and then we start with our grand kickoff Sunday evening, which we're just putting final touches on. So I'm looking forward to being able to announce some of our ideas for Sunday evening, and then the speakers for Monday and Tuesday. We've got some great speakers lined up again. We do have a draft schedule that's either coming soon online or it's up. But yeah, it's coming together really, really well. So we're looking forward to that. And again, I want to thank Dr. Nicol. We really appreciate you sharing your insights and information and expertise with us. It's been gret.
Well, thanks for having me. And I really am serious about helping people with statistics. If they'd like to just have some simple slides, I'm more than happy to help people create some visuals from those, your tax dollars hard at work at Statistics Canada, to help make and inform your practice. So let me know if I can help out.
Great. And so you can email that info@carst.ca email and we'll make sure that we connect you. Great. Well, thank you very much and have a great day.
Okay, bye-bye.
Bye.